Hi guys, so I wanted to go ahead and start doing dog restraint with you guys. These are my kiddos. They tend to not be the best ones to do restraint on because they are Huskies, which are northern breeds, who tend to be pretty dramatic anytime it comes to restraint or anything else. Okay, but I wanted to make sure that you guys could start practicing at home with your animals. So we'll go ahead and get started. Similar to cats, we still have our major vessels. So we have the jugular, we have the cephalic, and this one we have a lateral saphenous. So in cats, we do the medial saphenous, which refers to the inside of the leg, and on a dog, we do the lateral saphenous, which refers to the outside of the leg. Okay, so this is Baron. Okay, he tends to be a pretty good sport, okay, but he is dramatic as well. What I want to do is go ahead and get him into a, well, I guess since he is already in a laying position, we'll go ahead and do the lateral saphenous, okay, or actually, we're going to start with the jugular first because I want you guys to see me put him into a lateral position because not all dogs are going to just get in that position. Go. Okay, go. Come on. All right, come here, Ben. All righty, sit up. So what you want to do is you want to get them sitting in front of you, okay? You want to make sure that you are behind the patient because you want the patient not to be able to back up. And ideally, if you're in a corner, that's going to be best case scenario, okay? So for this, there's a couple ways, go Kyla, that you can do a restraint, okay? Most commonly is going to be holding the muzzle, using your elbows kind of to hold the neck area, and being behind that patient, okay? The other thing I'll do is kind of hold the muzzle, hold the legs, and hold up as such. Go. As such, okay? That's gonna give me control. I'm using my shoulder as well to help hold his head, okay? And I'm holding this area, staying clear of here where the draw is going to be, okay? For cephalic, I still want to maintain control of the head. I don't want to hold the neck. I want to hold the head, right? I'm going to turn his head. You can see my hand is on his head, okay? I'm coming behind the elbow. If you're behind the elbow, it's going to make the leg go straight. If you're not, it's going to be able to bend. So behind the elbow, okay? And you're going to do that roll off, just like so. All right, and I'm still behind the patient and everything, so this is how I'm going to be doing my cephalic hold, okay? Now we're going to put a dog into lateral recumbency, okay? Sometimes you can tell a dog to lay down and just do verbal commands as such. I want to show you an example as if they were not. All right, so what I would do is I'm going to take my patient, go lay down. I'm going to grab the under leg on each side, okay? I'm going to roll this patient down my body, and I'm using, I know, I told you dramatic, okay? I'm using my elbows on each side. My elbow up front is holding his face down. My elbow in back is holding the body. I'm still maintaining holding both bottom legs, okay? If I'm going to hold off for the vessel, I'm going to take my bottom hand, I'm going to move it to the top leg, and I'm going to squeeze the knee, okay? When you squeeze the knee, it's going to extend the leg out, and you're going to see that vessel pop, okay? Not going to see it in my Huskies because they have a lot of fur. But if you have a pitty or something with shorter fur, it should be blatantly obvious where it's at, okay? So that's how you do a lateral cephalic hold. Okay. Other things I like to point out is when getting a patient to sit, we never push on their back and force them to sit. What that can do is injure the dog, especially if they're arthritic. Okay. Get up, Aaron. So what we're going to do is we're going to do, Huskies do a spin around method. I know, he kind of sits already. But you're going to essentially hit the back of the knee and make them sit that way, okay? The other thing is if they're on a leash, they're more inclined to sit than they are to walk backwards, and you can do that sort of thing as well. All right, so hopefully, I hope that helped you guys. Let me know if you have any questions. We'll be doing more restraint this week.